So I'm just here to introduce Susan Shenkin, who is Susie, if you introduce yourself now. I'm feeling a bit giddy because it's the last person of the day. And we will get finished early, so I'll pass you over to Susie. Thank you.
Great, thanks, Emma. And thanks very much. I can take this off now, can't I? I'm so used to wearing them. And thanks, everybody. Thanks so much for inviting me to speak today. I just wanted to say it's really nice to be part of the triumvirate of people who look after people with dementia and neuroprogressive diseases, which I would say was old age psychiatrists, neurologists and geriatricians, and all three of us have spoken today, but much more importantly, people living with these diseases have spoken as well. So I think you've seen a really good flavour of the range of people and specialties that take part in looking after people with these conditions and designing and participating in the research to try and improve the outcomes for everybody for the future. So it's just been really nice to see that today, so thank you for that. So I'm a geriatrician. I work in Edinburgh, and I'm a clinical academic, so working part-time at the university there. And I'm here today to talk a bit about ENRICH Scotland. It's been trailed a little bit already. ENRICH is enabling research in care homes, and I'm just going to introduce that to you a little bit today with the absence of the vlogs. Sorry about that. So who are ENRICH Scotland? Well, you've seen the ENRICH Scotland table over here today. We're a multidisciplinary team, professionals from a range of backgrounds: nursing, social care, sociology, medicine, all the people who are involved in looking after people who move into care homes. And we really have a passion for improving access to research for care home residents, their families, and also the staff who look after them. ENRICH Scotland was working informally for a few years, and Emma has been instrumental in setting that up and driving it with her passion and enthusiasm. And just in the last year, we gained some funding from the Chief Scientist Office, and we've been supported by the NRS infrastructure, particularly the NDN, which is a great partnership, and we're working with the primary care and ageing groups as well. So who is the team? Here's a fabulous picture of when we managed to get together in my kitchen for a meeting with a special ENRICH Scotland cake, and just a few members of the team there. Emma and I share as co-chairs. Irina, who's here, helps with the health and social care side of things. She's the lead for that. Rosie Ashworth, you've heard of already, is helping us out with the Partners in Research side. Maria Drummond is our expert senior organiser of everything person, and Neil, who's been hot on the technology today, is hot on the technology and admin for ENRICH Scotland too. And we've got 4 fantastic clinical studies officers now in place across Lothian, Grampian, GG&C and Tayside, who I think are all here today. Would you like to wave? Here you are, brilliant. Thank you all very much. So this is the team. And what do we do? Well, the ENRICH Scotland network is really aiming to bring together everybody who is active in care homes. That's the staff, the residents and researchers, to try and make doing and delivering research work, to try to aim to improve the outcomes, quality of life and treatments for all residents and the people who care for them. And why is it important to talk about this today? Well, more than 70% of people who live in care homes have dementia or cognitive impairment. But I really also want to emphasise that not everybody in a care home has dementia or cognitive impairment, and clearly not everybody with dementia or cognitive impairment or neuroprogressive disease lives in a care home. So they're distinct but linked. But an important topic, I think, for all of us in society, as COVID has shown. And what are the main points that we do in ENRICH Scotland? We have 3 main parts. In the centre of the circle is our steering group, a group of people who are helping us to drive forward our research and the plans of what we do. We have over 100 now research-ready care homes. These are care homes that have signed up, who are willing to be approached to talk about research studies. More than 100 across Scotland, so a huge opportunity for these people to take part in research. But research-ready just means that they're happy to talk, but they don't have specific skills or training in doing the research. And the research forum is over 30 people who are interested in different aspects of care home research. And what have we been doing? Well, we've been very busy in our last 6 months since we've had the funding, engaging all these excellent staff members and supporting and designing research studies, particularly starting to build up a care home Partners in Research, or PPI group, and I'm really excited about the opportunity to do that because I think it's really important, as we've seen today. We've supported over about 20 study teams who've talked to us about different research studies since May, and we're recruiting care homes, as I said, to be research ready. We offer peer support, so if you want to do a study and you want to think about doing it in care homes, come to talk to somebody who's already done it so that we can share lessons. We're developing the Partners in Research group, and we've done some work about responding to consultations, like the recent consultation about the National Care Service, to make sure that thinking about care home residents and their ability to participate in research and to learn from and benefit from the best evidence is there in the National Care Service, whatever that ends up looking like. And we're also really keen to try and develop education and training for social care staff, because social care staff are really skilled in lots of ways, but they often don't really understand what research is. And many people think when you say the word research, they think you mean injections or something scary, and they don't understand that that can be something as simple as being asked a question or helping to design something that will help their practice. So we're trying to develop some simple online modules in collaboration with IRIS to help to educate people and developing that in conjunction with them as well, what research is about and how they can help. And Irina and Maria have already been involved in webinars with IRIS as well to try and spread the word and share the learning. So as I've said, we've over 100 research-ready care homes spread across Scotland. And these have the whole range from small and large chains and independent third sector, a wide range of care homes who are happy to be approached to talk about research. And from ENRICH Scotland, they get a certificate that they can display and show to residents and families that they are interested in taking part in research. And we're in discussions with the Care Inspectorate about getting that endorsed by them. That email's been in their inbox for about 6 months, so they'd like to. I'm sure they'll get back to us very soon about that. We connect with care homes in lots of different ways, directly through the clinical studies officers talking to the care homes themselves, using intermediaries like the care home support teams who may have closer contacts with the care homes who can come back and say, this care home's really interested in this topic, perhaps we'd like to engage in research ideas. We can talk to area managers as well. We can talk to the larger groups of care home providers, and we can also have interactions through the universities as well. So lots of different ways of connecting. And in ENRICH, we now have representation on the academic side from all the universities, I think, in Scotland pretty much. If yours isn't there, then please come and talk to us if you're interested in care home research. And we are really keen to have a wide inclusion from all the universities and from different specialties. Medics, nurses, social work, social care, sociology, you name it, care home research will be relevant, and you can provide your expertise to that area. So if people are interested in working in this area, we'd really like to partner up with you and share learning together. We did a survey of our forum of researchers, so over 30 members, as I said, with a wide diversity of different backgrounds, includes care home staff, staff from NHS, academics from lots of disciplines and universities, Scottish Care and this Care Inspectorate. And we asked them what methods have they used previously in doing care home research. And you'll see here that most people have done observational studies, and literature reviews, things like interviews and focus groups, qualitative methodologies. But a few people have done clinical trials of complex interventions in care homes. So there is an expertise in our forum of all different types of research in care homes. So if somebody wants to do something that they maybe haven't had so much of experience with before in this environment, we're really happy to try and support that with our peer mentor system. And what topics does our forum cover? Well, pretty much everything. You're going to see the writing's too small for me to read on my screen. But when we did this study survey this year, obviously COVID-19 was one of the most important, and dementia is one of the main topics that people have been focusing on. You'll not be surprised to see palliative and end-of-life care also being focused on predominantly, but a huge range of things that people are interested in, not just in the frailty and negative aspects potentially of these residents who may be approaching the end of their life, but positive things like the impact of exercise, diet, nutrition, and supporting people into the pathways into when they move into a new care home as well. And we asked our partners, the care homes that we partner up with, and on the Research Ready Register, what are they interested in? What would they like to be approached about to take part in research? And actually, you can see from the dark blue lines, we asked them these specific topics, but to be honest, they weren't that bothered. Some of them were more interested in one topic than another, but most of them said, just approach us, we're open to anything, and then we'll tell you if we're interested in that or not. So that was really nice for us to see that they're really open to discussions about what research might be possible. And we have a wide range of partners. The NRS Neuroprogressive Dementia Network and the Ageing Network and the Primary Care Network also have been very supportive of this work. Also the Care Inspectorate, Scottish Care, IRIS, and it's very important that we partner up with the social services, social work world, and so Scottish Social Services Council has been really important, and obviously trying to get funding from a wide range of different places. So NIHR provided support for ENRICH UK, which we build some of our models on. And I'm not going to go into detail of the studies that are currently ongoing. Maria would be really delighted to talk to you about any of that at any time, as would we all. But we have got a range of different studies that we're trying to support just now, and the clinical studies officers are recruiting into, including complex interventions, focus groups and interviews, online surveys and questionnaires, and analysing and using routinely collected data, which is widely used in the health sector, like you heard from Catherine with her dementia work, but actually collecting routine data in care homes and in social care is much less well worked out pathway, and there's a lot to do there where we can help people to participate in research who don't have to do anything, because it's an opportunity to use the information collected about them with their consent to inform clinical questions. So that's a really exciting opportunity that we're working on. So what's my take-home message? My take-home message is think dementia research, think care homes. Is it appropriate? Could you include people in care homes in your research? Think care home research, think ENRICH Scotland. We're here to help. We really want to. We want to know what demand is out there, and we want to create the networks with people across Scotland and other countries to see what we can do together. So that's our website, and these are all the ways to contact us. So please do get in touch, and I look forward to hearing from you. Thanks very much.
So does anybody have any questions that they'd like to ask Susie while she's here? No, once again. Yes, it's not been a day for questions, has it, really?
Thought in-person meetings might encourage people, but no, everyone wants to get in the warm, I think.
Oh, I have a question. A comment, right. Could somebody take a... I'd like to see families... I'd like to see families of people in care homes included as partners in studies. So the partners in research idea, families of people in care homes.
Yeah.
So getting this partner in research idea into care homes. I think that's what people are saying.
Yeah, we're absolutely 100% in agreement with that. Yes, please, and please get in touch with us, and you can join our panel that we're just setting up right now, actively engaging in a study that I'm planning to try and set up and to help us to drive our future ideas. So yes, please, if anybody who's on the call is interested in this, please contact us either through the contact details for ENRICH Scotland or through the Neuroprogressive Dementia Network, who can pass it on to us. We work very closely together. So yeah, totally agree and definitely want that to happen. So please get in touch.
And we have another question. So that's NDN, isn't it? The National Dementia Carers Research, no, Network. NDN, Action Network. NDN would be happy to help. So that's something perhaps we need to include in people that we contact to find out how we can get that going.
That's great, thank you very much, appreciate that.
All right. So I think it's now to me to thank you, Susie. That's
You're welcome.
really good. to do a quick sum up of the day. I hope people have enjoyed it. We have tried to bring together a little bit of everything that we do within the network. So starting off with Parkinson's, and then motor neuron disease, dementia, Huntington's, and the strategy launch today, which is exciting for us that we've done this. It was a bit painful at times, but we got there. And I think deciding not to have a printed version, because you all would have had a printed version, but what would you have done with that printed version? And then it would have been chucked in the back of a cupboard, as we all do. So having it online, available, it will be. We're going to send it out on Monday, so everybody will be able to have a good look through that. And I'll just take this opportunity to thank you everybody for coming, and for all those online. Thank you.